I know it's late in the day, but I'm excited to hear from our last speaker, Elizabeth Doerr. She's the Associate Director at Johns Hopkins University's SOURCE program, which is the Student Outreach Resource Center, and she's joining us by video cam, I can see up there. SOURCE is a community service and service learning center that brings together the medical school, nursing school, and public health school. So I'm excited to hear how she manages to do that. And specifically, she's focused on training the faculty around what service learning is and trying to find a way to institutionalize this. So I think this will be a really interesting talk. So we're going to go for about 15, 20 minutes and allow us a few minutes at the end for some questions. So go ahead. Can you hear us okay?
Can you hear us? Yes, I can hear you. Can you all hear me okay?
Yes, I think so. Thanks.
All right. Thank you for the introduction. So I won't give you too much of a background on myself, as you just got an overview of what SOURCE is, but I'll give you a little bit more of an in-depth overview of what we are and what we do. So, we're the Community Engagement and Service Learning Center for the Johns Hopkins Schools of Medicine, Nursing, and Public Health, and we were established in 2005. So we just had our 10-year anniversary last year, which is really great. And part of our model is partnering with about 100 different community-based organizations, and all the organizations that we partner with are in Baltimore City, and we have an application process for those organizations to become an official partner. We have a variety of different programming that we offer to students, faculty, and community partners. This is just a basic overview of some of the things we have. We have special programs like an HIV counseling and testing program. We do educational events like Baltimore Week, which we have in the first week of October, where we have panel discussions and presentations about issues going on in Baltimore, and most recently doing a lot of education around the Baltimore uprisings and kind of the root causes of how those came about. We also have a program called the SOURCE Service Scholars Program, which is it's a tri-school program, so we have interprofessional education involved in that for students working with community-based organizations over an academic year, and so they also do training and have a cohort model with that as well. Because we serve 3 different health professional schools that all function very differently, we have a very strong focus on interprofessional education and ensuring that students from each school are interacting with each other and learning about the other's fields, and just building those relationships. And then we also provide a series of online educational opportunities. We have online modules to prepare students to work in the community, and those are all available on our website if you're interested in looking at those later. And then as far as community engagement options go, we offer pretty much everything from one-time to long-term. And by long-term, we're talking academic year long-term. So, so 1 year is long-term for us in these programs. But we offer internships. We do practicum projects. One of the things that I do most of is service learning courses, so training faculty in service learning pedagogy, which I'll talk more about that later. So this is our mission. Our mission is to provide academic and professional and personal development for the JHU Schools of Medicine, Nursing, and Public Health through community outreach and service learning partnerships. And our values, I think it's important to root this discussion in our values and how we approach the work that we do. And one of the most important ones is reciprocity. We need to make sure that both parties are getting a benefit out of the partnership. And so we work with that's one reason why we actually have the organizations apply for partnership, because we want to make sure that the students are actually going to utilize their services. So currently, right now, we're not accepting applications for purely tutoring and mentoring because we already have schools that we work with that are in East Baltimore that are close to campus that we've been working with for years, and we've kind of saturated the student interest in that way. So we want to make sure that there's reciprocal benefit and that we're actually able to give back to the organizations that are applying for partnership. And collaboration is also a big part of our work. We don't do it in isolation. We work with students, we work with faculty, we work with community partners to develop all of our programming. And we are focused on serving the communities based on their needs. So we want to respond to community-identified needs. What tends to happen sometimes in community service projects is that, especially if it's a required service learning component and the faculty member hasn't identified the project in advance, the students have to go out and find their projects on their own, and they kind of do it frantically, and they say, I want to do this kind of project, and the organization is expected to fit that into their goals. But what we try to do is flip that around and make sure that the organization is doing something that they actually need out of it, and they're going to, and this takes a lot of negotiating sometimes while they're doing the project, because it evolves and changes, and so that's a really important aspect of what we do. And we also, the do's and don'ts of community partnership is a big thing that we talk to students about. I think sometimes we, especially coming from academia, from Johns Hopkins University, students go in with this idea that they're the experts and know what they're doing, but we really want them to make sure that they're going in with humility and with identifying the assets of the community, and we do this through kind of our educational and reflective processes. So to kind of root what we do, before I go into kind of the opportunities and challenges, I just wanted to give you this definition of service learning. So this is from Community Campus Partnerships for Health, and this is the definition we use of service learning. So service learning is a structured learning experience that combines community service with preparation and reflection. Students engaged in service learning provide community service in response to community-identified concerns and learn about the context in which service is provided, the connection between their service and their academic coursework, and their role as citizens. So in service learning, we strive to balance service and learning, and so it's not, we try to make it as equal as possible, and there's also, it's learning, the actual academic learning and the reflective learning, and then also the direct service that they're engaging in. And we also work to address community concerns and social determinants of health, and we also encourage faculty to have discussions about social determinants of health in the context of the academics and the service learning projects themselves. It also integrates community partners into the process. We emphasize reciprocal learning, and so the lines are a little bit blurred sometimes between faculty, teacher, and learner. We really want faculty, of course there's going to be lecture periods where the faculty is teaching in front of the classroom, but we also want it to be a reflective, open discussion where the faculty member is also taking a learner role as well. And that's where it kind of emphasizing reflective practice. And so we want students to think about the connections that they're making at their community sites with what they're doing in the classroom. And so that really helps them foster critical thinking and self-awareness. And then, going off of that, it develops civic skills and focusing on achieving social change. And so that's where we kind of want to push them forward into their roles as future health professionals. So as I mentioned, we serve the schools of medicine, nursing, and public health, and they're all very different. It's not, sometimes it feels like we're working with 3 different universities. They're all funded differently. They all fund us differently. And so the strengths and the challenges are really quite different from school to school. And so I'm just going to go from school to school to tell you what are our strengths and challenges in those areas. So at the School of Medicine, the students have a curriculum called Genes to Society, which is it's fairly new. I think they implemented it about 3 or 4 years ago, and they recently went through a self-study to ensure that they were adhering to all their guidelines. And so one of the things that they actually found is that there wasn't as much of society in the Genes to Society part, and so we're now working with them to see how we can do that. But one of the strengths that they have in the School of Medicine is that we have consistent student group engagement. So we have great student groups, and that's pretty much the majority of the med students go do their service through student groups. We don't have as much partnership through courses just because and I'll go into that in the challenges. We have high quality students and faculty participation. And you'll see that in all of the schools, because those that do work with us are really amazing and very passionate about working with the community. The nice thing about the medical students is that they're there for 4 years, which is not the case for our nursing and public health students, and so we have them for a longer period of time. And then we also, with the LCME accrediting standards, the source helps the School of Medicine actually comply with those standards of making service learning available. So as far as the challenges go, we kind of, with making service learning available, it's really the bare minimum of the requirement, and we'd like to see more. We want to see more engagement, more active engagement, and having discussions about social determinants of health. Currently, discussions about social determinants of health are kind of on, a basis for students to seek out on their own. We do have a course, and I should have put this into the strength section, but we have for incoming first-year medical students, our director, Mindy Levin, actually runs a course with a faculty member at School of Medicine called Time Healthcare Disparities. And so the students actually do some work in the community, and they learn and discuss about healthcare disparities for their first 3 days. The challenge is that right after that, they go right into anatomy, and we kind of lose them. And so it's, there really isn't that consistency with that. And so that actually goes with the Genes to Society curriculum. It's really tight, so it's really difficult to have service learning in that curriculum, especially when we're doing it after the fact. And so students are so limited with their time that they really don't take electives, and that's really how we're able to do academic service learning is through electives. And I'll talk a little bit about some solutions we're already exploring for that later. Faculty also are limited in their time. Many of them are also full-time practicing physicians, and so doing service learning takes a lot more time than teaching a regular course. And then also, I think sometimes we have to do a little bit of extra convincing of administration about experiential learning and its worth in educating about social determinants of health. So the School of Nursing, we have a little bit more structure in place to serve nursing students through the academic coursework. And one of those programs is a community outreach program. And so that's a program where we have about 60 nursing students a year actually receive funding, which is something that the School of Nursing provides to work with a community-based organization over the course of an academic year. And so it's a really cool program. It's one of the most, it's one of those lauded programs from the nurses, especially those who are interested in community nursing. Again, high-quality students and faculty participation. Students are really mature and experienced. A lot of our nursing students typically are a little bit, they're not right out of undergrad, and they're typically they have some life experience and work experience. We have a lot of return Peace Corps volunteers because of the Peace Corps Fellows Program, and so these are people who have a lot of experience and a lot to offer to the organizations. The administration is also working to dedicate more funding towards increased efforts and support, which is great, and that's currently in the works. And then they have a Department of Community Public Health which there's a clear tie between what we do and what they do, and so we have really good relationships with them, and a strong connection with the Center for Global Initiatives. Although we don't do any international work ourselves, I do support them in pedagogy. My background actually is international service learning, and so I've been working with them on some projects where at least we'll train the students and they'll be using service learning pedagogy. Some of the challenges is that oftentimes, especially we see this more in nursing than elsewhere, is that the definition of service learning is often misused or not understood, and so they do a lot of clinical work, and some of the faculty already think and say that they do service learning, but then we have faculty who go through our training and they realize that it's not what they're doing. And so, it's helped having more faculty who are trained in the school to understand that, and so, and to kind of spread that knowledge amongst their colleagues. Student schedules and clinical time limits their commitment. The clinical time is really challenging. because they have to do that. They have to learn those clinical skills. And so, but it's really, they're different schedules and they have different cohorts. Electives are also limited in nursing. Faculty are spread thin. It's consistent, amongst the 3 schools. And also, currently we have extremely accelerated programs. So we have 2 bachelor's in nursing programs that are, one is 13 months and one is 17 months. However, we're now transitioning to a master's entry only program. So that actually will be changing, which is great. So we're interested to see where that goes. And then the accrediting body doesn't have a requirement that connects the experiential ed. And then last, we have the School of Public Health. And the truth is our programming is probably the most robust in the School of Public Health for a number of reasons. Part of the reason is, we came out of the School of Public Health. Before SOURCE became a tri-school center, we were a program within the School of Public Health. But also it's a more typical academic schedule. The students aren't doing clinicals, they aren't going into the wards, and so it just is easier to work with in that. Like the other schools, we have high quality students and faculty participation. Students, again, similar to nursing students, have experience. Most of the students we work with are masters in public health students, some PhD students, and some that are just in the MSPH program, which they're mostly right out of undergrad or interested in going into med school after that. But the MPH students are required to have at least 2 years of somewhat public health experience, and so they also have some really great experience to add to the program. We have a larger number of faculty participation for academic service learning. And with it, we have a wider variety of course options. So, we have some that are, pretty typical service learning courses, like a Baltimore food systems class that you might, it seems pretty easy. But then we also have data analysis classes and a biology class. So it's been really neat to see the evolution of that. The accrediting body, CEEP, also requires a practicum for all degree-seeking students. So masters in public health students are all required to do about 100 hours of practicum in the community before they graduate. And so we've been a really big part of that. And last year we actually had our review from CEEP. They came to visit, and afterwards, and we feel very proud of this, they had told the committee that, you passed, but we're drooling over SOURCE because there really isn't anything like this at any school of public health. And so it was really a proud moment for us to see that they valued what we did. Also, social determinants of health are inherently a part of the public health education, and so it's a little bit easier to put those in. And then we have a strong administrative support and advocacy. And again, there are challenges, just there always will be. But those challenges are, again, accelerated programs. The MPH program, as I mentioned, is only 11 months, and these students have to complete 100 hours of practicum within that 11 months. So it's very fast. And students are extremely busy and overstressed. And the academic terms are only 8 weeks long. And so this is something we've learned to figure out how to craft a course that exists within an 8-week time period with a project that can begin and end during that period of time. And we've largely been successful. There are always challenges, but that can be really challenging. And I think that this is the case in all of the schools. I think we're probably a little bit further ahead in school public health, so we're trying to make some inroads in this area, but teaching and community engagement are not as valued in the promotion and tenure process. And so, it can be the thing that is first cast aside, especially when you're going up for tenure. And so that's something we're trying to work on and make sure that that's something we change a little bit in the culture. So rationale for increased service learning that we've been proposing to the university and to our schools, which we actually are starting to get some dedicated support to continue and actually grow what we already do. But linking directly with university strategic priorities, our university president has a 10 by 20 plan for Hopkins, and one of his goals is to have a stronger connection to Baltimore City, and so that's what we're here for. We want a stronger link to social determinants of health. The real world application to social determinants of health. it's also a part of being a responsible community member within our city. You know, we want the education to happen in the context of Baltimore City and for students to see it as their home, at least for now. We had one student who was writing a blog post for us who said in her post, which I thought was deeply put, that, you know, you may not be in Baltimore forever, but it is going to be a permanent part of your life, just being educated here. And so we want students to explore that community and to work with that community as well. Experiential learning theory, also applied to community service context, is also proven to be good learning. It's a really students learn more by doing, and so that's something that's also really important. And then last but not least, students actually want service learning. We found out every year we send out a survey to the student body from all of the 3 schools, and last year we got this feedback. We got about 77% said that community involvement is an integral component of my health professional education, and 72% said, I believe that service learning should be a part of the academic curriculum in my school. And then just to kind of beef that up, we have a few quotes from some of the students that have worked with us. So one 4th-year med student says, not only has this made me a better clinician and physician to be, but it has also helped me to discern what I want in my future career. And then a School of Nursing alumni who graduated last year wrote that her Dayspring is her community outreach program site. It gave her a chance to work with the most resilient women I have ever met to understand how violence, substance use, and negative experiences with the criminal justice system impact our community and add to a fundamental lack of trust between patients and care providers in Baltimore City. And then this is from one of our students who's an MD PhD student. She's currently finishing up her PhD at the School of Public Health, so she's been here longer than I have, actually. But she says that her work with SOURCE is the foundation of her health professional education. Sustained engagement in community has provided me with a real-world context to understand and apply ethical principles, especially respect for persons, beneficence, and justice, and understand their importance beyond the context of research studies. And now just one last, I have just a couple more slides, but one of the top barriers for service learning, so students want it, but the biggest barrier is that they don't have enough time due to academic responsibilities. I mean, and that's also the biggest barrier for faculty. It's just hard to fit it in. And so some of our solutions is that we integrate service learning as a part of the curriculum through our SOURCE Service Learning Faculty and Community Fellows Program, and I'll explain that in just a minute. But you know, having the academics and the service work is not mutually exclusive. You combine them. We also want to implement funding for long-term engagement with a stipend. So, for example, our SOURCE Service Scholars Program, it's a nominal stipend, but it gives students an incentive to do this work. And so they are trained, and they also work with the organization up to 4 hours a week for the academic year. And so I think that that stipend really helps. And then last, this one's more specific to the med school, because we've kind of, you know, decided that it's going to be too hard to actually integrate service learning into the existing curriculum. And so what we're trying to do is work with them to create some experiential/service learning requirements outside the main curriculum. So the students would be required to achieve this on their own in order to graduate, but we would have to help them find those, kind of like the practicum, like they have to do that outside of their, in the School of Public Health, they have to do this outside of their coursework, and so it'd be kind of the same in the med school. So we're working on something like that. And now just to go back one step, I wanted to just talk briefly about the SOURCE Service Learning Faculty and Community Fellows Program. And so this is actually how we're able to integrate service learning into the curriculum, is that we train faculty and community partners, actually. They're trained together on service learning pedagogy. And then what we do is support the faculty in curriculum development. We also match them to projects, and we help them manage the courses. and you know, help them craft their syllabus and all of that. We give them comprehensive support, and not just the first year, but you know, ongoing. We'll support them however long they're teaching the course, and so that's the way we're really able to develop some really high quality service learning courses. So that's my presentation. I'm happy to take questions, and feel free to contact us at Source. And I don't have my email up there, but you can always, you know, just email that and ask me questions through that, and our colleague will forward it to me. So if you happy to take questions now.
Great. Thank you so much, Elizabeth. Let's give her a round of applause.